Clinical examination of the musculoskeletal system. Examination of the shoulder joints. To examine the shoulder joints and fully expose the upper parts of the body to ensure adequate comparison with the opposite side, and note any swelling, deformity, or bony enlargements, and note muscle wasting, especially of the deltoid and posterior shoulder muscles, and note the size and position of the scapula as winging of the winging of the scapula occurs with paralysis of the nerve to the serratus anterior. To palpate for tenderness, synovial swelling, and fluctuancy for effusion. And tenderness around the shoulder is common in normal people. Hence, if an area of tenderness is detected, compare it with the same side on the opposite shoulder before you attach any significance to it. Next, you test for the range of movement and compare the two sides. Rotate the shoulder with the elbow flexed and hand supinated. Internal rotation is rarely limited. Externally rotate the shoulder. Limitations of external rotation of the shoulder joint means pathology of the glenohumeral joint. And if the patient get the patient to perform adduction and abduction movements at the shoulder, and notice any tenderness as the patient performs this act. The tenderness will lead to restriction of movement. And global restriction of movement indicates disease of glenohumeral joints, for example, synovitis, rheumatoid arthritis, and septic arthritis. A restriction of adduction is due to pathology from acromioclavicular joint or acromiohumeral joint space. Pain with full range of motion or full range of movement means one of these. Could be lesion of subacromial bursa, or lesion of supraspinatus, lesion of infraspinatus, and lesion of subscapularis. So to determine which of these lesions is involved, it tests for their specific movements at the shoulder joints. So movement results in pain in shoulder joints, and hence movement is restricted. Combination of painful act, restricted movements, and possibly localized body tenderness indicates which lesion is present. The resistance to abduction means supraspinatus tendonitis, and resistance to external rotation means infraspinatus tendonitis, and resistance to internal rotation means subscapularis tendinitis. So this knowledge helps to determine where to place corticosteroid injection on the treatment of these common inflammatory conditions. A rare cause of painful shoulder movements is neuralgia amyotrophica. This results in painful restriction of movements plus wasting and decreased sensation of the medial side of the deltoid muscles. Assess the function of the shoulder joint and place the hand on top of the head if one is combing the hair. Then you place the hand on the opposite shoulder, and then you let the patient perform the complex movements of the abduction, extension, and internal rotation of the shoulder, and get him to place the hand on the muscles of the back. The above movements, or the movements I mentioned, are necessary for dressing and undressing. So if despite careful examination no pathology is detected and pain in the shoulder is referred from cervical spine, then it would be necessary to examine the neck for loss of movements and tenderness, and feel the shoulder and get the muscles for spasms. The referred pain does not only go to the shoulder, but is also referred down the arm and the distribution of the dermatome.